Hello, I'm Eric Shawn. Time now for Sunday House Call.
And I'm Marcel Neville. Welcome. And joining us is Dr. David Samadi, Chairman and Professor of Urology at Lenox Hill Hospital and Chief of Robotic Surgery.
And Dr. Marc Siegel, Professor of Medicine at NYU's Langone Medical Center, also the author of The Inner Pulse, Unlocking the Secret Code of Sickness and Health. Doctors.
See you, Doc.
Nice to see you.
Very good. Okay, we're going to start today with growing concerns about the Zika virus after thousands of pregnant women have become infected with the mosquito-borne virus. Both patients and doctors telling our Dr. Siegel they are very much on edge.
I just got bitten, there are so many uncertainties, and I just want to have it checked out and see, because I'm so early in my pregnancy.
We're seeing a lot of concerned patients who are returning from what they thought were going to be pleasant vacations. It is hard to relieve their anxiety. What we're trying to do is arm ourselves with the most information we can and pass that information on to our patients. What we're also doing is for patients who do come to see us and are part of our program, we're tracking them and we're keeping their names on a list so that if there are any changes in guidelines, we can reach out to them.
Okay, this situation is sparking a lot of concern, including this question from one of our viewers. Here it is. My 37-year-old daughter was bitten several times while on vacation to Punta Cana, Dominican Republic in October. 2 months later, she became pregnant. Do we have cause to be concerned, Dr. Samadi?
The short answer of this is absolutely not, because the incubation period for Zika virus is about 2 to 3 weeks, not 2 months. And of course, she can get tested to see if she's positive for any issues before she can become pregnant. Why are we talking about Zika virus? This is a totally different situation.
But if I can jump in, I want to ask you a question specifically about this lady, because you just told me that the incubation period is 2 to 3 weeks.
Yes.
So this woman who became 2 months later doesn't need to be concerned. But can she get treatment for this virus, considering she is pregnant?
Well, we don't know if she's positive, number one. So the first thing I would do if she wants to get pregnant, she has to get tested and see if she is positive for Zika virus. And then, obviously, if it's negative, she can go ahead and get pregnant. So that's really not the case. If it was 2 weeks, 3 weeks, then I think it would be a concern, and I would absolutely be seeing the gynecologist and the doctors. Zika virus started about 1947 in forests of Uganda. Nobody really cared for it because it wasn't spreading out of Africa. It took years before it went to South and Central America. In 2007, it became a problem in Brazil, but they eradicated this virus and the mosquitoes, and it was until May of 2015 when it became clear. At that time, they didn't take it seriously because the symptoms, as Mark will explain, mild fever, rash, maybe body ache, but it's not a big deal. It doesn't affect anybody. But once it's already become a big numbers, over 1 million people, and we start seeing microcephaly. That's what we're talking about. Pregnant women who have Zika virus, still we don't know the cause, but there could be some association between these small head, microcranium, small heads that can lead to retardations, language barriers, etc. And that's why World Health Organization is warning people, pregnant women, in order to, if you are planning to travel to these 26 countries, which is going to be online, please stop doing that because you could expose your kid to
And Mark, the other issue is, how do you know it doesn't affect you in some other way? I mean, they deal with this horrible situation with the size of the skulls. Do they have enough research to know how it can affect us, whether you're pregnant or not?
Guillain-Barré.
Eric, great point. It's an emerging infectious disease for us because even though it's been around since 1947, it's only now that it's burgeoning in Brazil. And it's, as David mentioned, it's because mosquitoes were wiped out in Brazil that carry this. The Aedes aegypti mosquito carries this. They wiped it out because they were trying to get rid of dengue fever, which is also on that mosquito. This mosquito carries yellow fever, dengue fever, chikungunya, and now Zika. So it's a real killer, the Aedes mosquito. And it's not really found throughout the United States except in southern states, and dengue has never really taken hold here. But down in Brazil, it's burgeoning, over 2 million cases down there.
Well, you got 2 states now, the states of emergency. I mean,
well, I want to talk about that. First of all, 80% of the time you have no symptoms. So there's a lot of people out there that have it that don't know it. Rapid testing for Zika virus is just coming into play
even
now.
Americans right now may have it?
Because all the people you mentioned, about 50 cases, Eric, they're all travelers.
Okay.
It hasn't spread here because it's a mosquito-borne illness. Now,
Yeah, but
we've heard in the news a lot about sexual transmission and about urine and about saliva, but the fact is there's only been one case of sexual transmission here, and we pretend we don't know anything about this virus. Let me tell you something. In French Polynesia in 2013, there was a huge outbreak, well studied, and it does not commonly spread by sexual transmission. It's mostly mosquitoes. Mostly mosquitoes.
And we're going to continue after the break, but a question to think about for me is you said, Dr. Siegel, that it's mosquitoes to humans. Isn't it also humans to mosquitoes?
That's a great
answer
point.
When we come back.
That is a great point.
And we'll talk about it when we come back.